We're in the home stretch. Welcome back, everybody. The next session is called Research and Communication Gaps and Opportunities. As we just heard during the last session, it sounds like there are some communication issues around the use of respiratory protection and masks, barrier masks. The moderator for this next session on communication gaps and opportunities is Dr. Veenema, who's from the Hopkins School of Nursing. So take it away, Tanir.
Thank you very much, Melissa, and good afternoon, everybody. It's an honor and a privilege to join you all. And I first have to give my applause to the amazing depth of these session presentations and thank all of our panelists on this 2-day workshop. Clearly, there's innumerable challenges at play here with respect to respiratory protective devices, conformity assessments, processes for evaluation, unanswered research questions, and then, of course, communicating this information to non-traditional workers, their employers, and to the general public. So it's with great pleasure that I'm able to host this session to address some of these pressing issues in terms of research and communication. And we have an absolutely stellar panel to present and discuss these issues today. So first, to just go over what the objectives of our session are, we're hoping to identify research gaps related to the assessment of respiratory protection and the needs of different user groups. We're hoping to explore research priorities related to human factors engineering and the psychology around the use of respiratory protective devices outside of a formal respiratory protection program. And then finally, we're hoping to discuss and illuminate those challenges related to user acceptance. So this is the part of the workshop that I'm most excited about, bringing it right down to that user knowledge, awareness, and assessment. And we've already heard from the previous speakers about the importance of knowledge of the right type of facial protective covering or right type of respirator and its proper use and its consistent use. So we'll really be exploring user acceptance and approaches for developing communication guidance on the effective use of respiratory protection equipment for non-traditional workers and for the public. And so to begin, let me start off by introducing our first speaker today. Dr. Rachel Jones is an associate professor at the University of Utah. She has her MPH and her PhD in environmental health sciences from the University of California at Berkeley. She has done a lot of extensive work looking at infectious agents encountered by healthcare workers and sought to explore processes by which these diseases are transmitted person to person. I'm going to refer more detailed information about the bios of all three of our speakers to the website. You can read more specifics about them there, but let me start off by welcoming Dr. Rachel Jones first.